We've got a rabbit today, a little male lion head that has a lameness on his rear back leg, and we're going to check that out. Possibly there was an infection here that in the bone that weakened the bone and ultimately caused a fracture. We need to do some needle cytology and try to aspirate some of this joint fluid and have it analyzed and see what's going on here, see if we have an active infection that needs to be treated. Okay, we've got this joint prepped and clipped, and now we're going into the joint, trying to get in between the bones so that we can aspirate a little bit of joint fluid. And we're going to take this joint fluid and do cytology, looking for any signs of infection. And we're also going to culture it. We've got some joint fluid here. Fortunately, we had a little bit of blood contamination in it, but this should give us a sample that we can use as far as looking for any signs of infection. Okay, we've got our sample. We're going to allow this rabbit to wake up. We're giving him pure oxygen now, and we'll give him oxygen until he starts to recover, and then we'll let him continue to recover on his own. We're going to send this guy home with something for pain management. We're going to put him on Medicam, which is a non-steroidal anti-inflammatory. We'll reduce inflammation and pain where we've done our needle cytology. Okay, we did cytology of the fluid that we aspirated out of this joint. Unfortunately, we've got some blood contamination, and these red oval things are red blood cells. But in the background you can see these dark purple staining objects back here is bacteria. So we do have bacteria in this joint. We're going to send off a culture, and the purpose of that is to grow this bacteria, find out, identify it, more importantly, test it for different antibiotics and make sure we're treating this infection with the correct antibiotic. We're treating it with an antibiotic that will in fact kill this particular bacteria. We're going to initially go ahead and start this rabbit on Baytril or enrofloxacin. It's a good antibiotic that gets good penetration into the tissues and into the bone, and it's a good first choice antibiotic, not knowing what this bacteria is and what it's sensitive to. Okay, going back over this case, we have a foster rabbit with no known history. He has an injury on his left rear leg. We had a swelling down on the hock area. He's able to use this leg, but he is lame. He's kind of gimpy on it. On radiograph, we found that the bone was very porous in the tarsal region, and the calcaneus had completely fractured and had been pulled up by the Achilles tendon. We prepped this leg, sedated the rabbit, aspirated some joint fluid, and found bacteria on the cytology. So we are going to, again, start this rabbit on some pain medication, some antibiotics, pending the culture result, which we should get back in about 5 days. And from there, we'll see what our next plan of action is.